Hello, we're two pharmacy students from MCPHS University presenting a patient, TS, who's a 51-year-old Caucasian female, and we are going to present a patient case on TS today. For starters, I'd like to introduce myself. I'm Sabrina. I'm a second-year pharmacy student.
I'm also Sabrina and also a second year pharmacy student.
Okay, so today I'm actually going to cover a few things with you. I'm going to talk about some of the subjective findings that we found with our patient upon interview, and I'm also going to go through an assessment and a plan to hopefully correct some of the problems that our patient TS is currently having. So, TS is, her chief complaint is she can't get a good night's sleep because she's been having recent hot flushes that have been keeping her up at night, and her doctor just told her that it's a sign of menopause, yet she's not currently being treated for it. So her history of present illness is she has been having these hot flushes now for about 6 months, and it is causing her some sleep disturbance. Her past medical history is positive for high blood pressure, obesity, recent onset of insomnia, which has been happening for about 6 months now, as stated before. Also, she has ADHD, and she had adult acne. However, that stopped around the age of 30. Currently, she has 2 living children, and in her family, they have high blood pressure in the family on both sides, the mother's and father's side. And on the father's side, they do have a history of stroke, and her father recently died at the age of 82 years old of prostate cancer. Her mother is currently living. She's 81 years old, and she suffers from obesity currently. The social history of TS right now, and she has no illicit drug use. She's negative for tobacco use. She does drink socially, around 2 drinks per month. However, back in college, she did drink around 10 alcoholic beverages a week. However, she graduated in 1984, so that was a while back, and it was only for 4 years of her life. She's currently married and self-employed. She owns her own company, and she lives with her husband. Some of the allergies that we found upon interview, they weren't medication related. However, she did have an allergy to honeydew, and she basically just gets a swollen mouth and tongue from that. And also, she's allergic to MSG preservative. She tends to get GI upset and diarrhea from that. Some of her medications include lisinopril and hydrochlorothiazide for her high blood pressure, which is now controlled. She's on the 10 milligram lisinopril and 12.5 milligram hydrochlorothiazide combination product. She's currently taking 1 tablet by mouth once a day in the morning. And she's also on her methylphenidate for control of her ADHD symptoms. She's on the 54 milligram dose, and she takes 1 tablet by mouth every day in the mornings. She's also on aspirin 81 milligrams. She takes 1 tablet by mouth daily as well. And she's currently on lorazepam 0.5 milligrams, and she takes 1 tablet by mouth as needed for sleep at bedtime. And melatonin 5 milligrams, 1 tablet by mouth at bedtime as needed for sleep as well. So now I'll have Sabrina jump in and talk about some of the symptoms that our patient is currently having.
So, TS's review of symptoms are positive for night sweats and fatigue. She has negative vision problems, negative glaucoma, negative double vision, negative cataracts, negative hearing problems or ringing in the ears. It's negative for earaches and sensation of room spinning. She does not have nasal congestion, nosebleeds, nasal discharge, or infection. She does not have problem swallowing, sore mouth or throat, hoarse voice, or bleeding gums. It is also negative for swollen glands, diabetes, thyroid problems. She is negative for cough, sputum, cigarette smoking, shortness of breath, and wheezing. And she's also negative for heart pain, heart irregularity, swelling in the legs, high blood pressure, palpitations, and difficulty breathing when lying flat. Her GI symptoms include constipation, but are negative for reflux, heartburn, hepatitis, stomach or intestinal ulcer, or nausea and vomiting. Her genitourinary symptoms are also negative for frequency, blood in urine, burning with urination, difficulty holding or controlling urine. And she has negative musculoskeletal symptoms such as joint aches, leg weakness, muscle weakness, or muscle cramps. She's also negative for headaches, seizure, tremors, migraine, numbness, or fainting. And she does not have any bleeding, blood clots, or swollen glands. She does have seasonal allergies, but she does not have rash or any current infections. Her psych symptoms include sleep disturbance and night sweats, but are negative for depression, anxiety, or crying spells. And I'm going to have Sabrina come in and talk about our assessment of the patient.
Okay, so as you can see by some of like the subjective and review of symptoms or systems, TS is experiencing, we are assessing that the patient is experiencing the hot flushes due to menopausal symptoms, which is causing her some sleep disturbance. So we would like to recommend a therapy for this patient to decrease the hot flushes, and hopefully this would help with the sleep disturbances so we can take care of two things at one time. So we would like to recommend venlafaxine, 75 milligrams, the extended release version, and we would like to recommend 1 tablet by mouth once daily. The reason that we came up with this therapy is we referenced some of the clinical guidelines. We referenced Dynamed, and we found that that is a first-line therapy for someone experiencing vasomotor symptoms, such as the hot flushes due to menopause. And we also found some primary literature and randomized controlled trials that said that venlafaxine is also a good therapy for this type of symptom. Along with the drug therapy, we would like to recommend a non-pharm plan as well, and that would be to we would like to recommend some sleep hygiene techniques that our patient TS can perform daily to hopefully help her get a good night's sleep. So we would like to recommend that she's only using the bed to sleep, and also for intimacy. We don't want her to bring any work with her to bed, because that can cause like sleep disturbances. Also, we would like to recommend that she does exercise, which she's been doing a great job of, as we could tell by her interview earlier. However, we'd like to recommend that she pushes that more toward the morning, so she's not trying to exercise at night, which could stimulate her. We don't want her to be awake due to that. Also, we would like her to just try to not worry at night. I know it's easier said than done, but we'd like to have her schedule her worrying during the day if that's possible at all, so she can have a good night's sleep. So we're going to try the drug therapy and also the non-pharm. And with this pharmacological agent, we need to monitor for efficacy. It's been stated that venlafaxine takes about 4 to 8 weeks to start working, so we should see a decrease in these vasomotor symptoms within that time frame. Also, we need to monitor for adverse effects, and some of the common adverse effects with this drug therapy are headache, dizziness, insomnia. It can cause sleepiness as well in some patients. nervousness, anxiety, nausea, constipation, anorexia, and weakness. So although those aren't common or too common of side effects, they're not very prevalent, we do want to watch out for some of those, or all of those rather, with this patient. We would also like to follow up with our patient in around 6 weeks, considering the efficacy does take 4 to 8 weeks to start working. So in about 6 weeks, we will evaluate for the efficacy, and we will also see if we can hopefully discontinue the lorazepam and melatonin regimen. Hopefully she will be controlled with her hot flushes and also her sleep disturbance with the new therapy and non-pharm that we've recommended. So hopefully we can discontinue those 2 agents as well. For her constipation, we would like to recommend that TS increases her fluid intake. We found that she's only drinking about 1 bottled water a day, so that's not enough water. We'd like to recommend about 64 ounces a day, and hopefully that will help her with her constipation. If not, we can follow up with the patient, and she can also visit her primary care doctor to see if there's any other recommended treatments for her constipation, or we could also recommend an over-the-counter laxative if it comes to that point. So overall, like we said, TS, she has a few symptoms, and we would like to control that with our drug therapy and also our non-pharm. So that's basically what we have for our presentation today. Thank you for watching. We'll see you later.